If you are uncomfortable or you are at risk of pregnancy or sexually transmitted infections or STIs, consider taking emergency contraception or the morning after pill as soon as possible. This is the most effective way in which one can take within 72 hours, but can be taken up to 120 hours after unprotected sex. Additionally, consult your healthcare professional on STIs prevention and also on management. Guys, welcome to our channel today. The channel is Future Talks, where we get to talk matters medical today in the simple words which we can always get to understand. Kindly, if you have not subscribed to our channel, I want to encourage you to subscribe to our channel, because that is the best way in which you can always support us. Today we are going to talk about what to do immediately after unprotected sex, and I want to state the 10 things which you need to do after the unprotected sex. Number 1 is about emergency contraception. Consider taking emergency contraception, that is morning after pill, as soon as possible. Second thing, consult your healthcare professional or seek medical advice from a healthcare professional for personalized guidance and guidance based on your situation, because your situation may not be my situation at the end of the day, because the situations can be very different, and that's the time management also is dictated by the way what you have really experienced. Number three is about the STI testing. This is where if you are concerned about the STI, get tested, and some infection may not show immediately the symptoms. So this is where now you get to your healthcare provider gets to discuss with you on the STI prevention, where you're given some medication to prevent an infection. Number 4 is about discuss the same with your partner. Open communication with your partner about the situation is important for shared decision making, because at the end of the day you also need your partner to get to also get, if is exposed, you get to know the history, and also if there is any care which is needed, it can be given at that particular point. So another very important thing is about planning for the future. So consider a long-term contraception plan to prevent future unplanned situations, especially for pregnancy, where you get a long-term family planning method. And on the STI prevention, you encourage one to use protective gear, especially the condoms. Another very important aspect is about learn about risks. Educate yourself on potential risks of unprotected sex, including pregnancy and the STIs. So you also get to learn about on your future, on how to protect yourself from especially the STIs and also the pregnancy or unplanned situation at that particular point. Also monitor symptoms. Even if your doctor or your healthcare provider puts you on a certain management, it's important that you get to monitor the situation, so that you get to see if there's any symptoms, unusual symptoms, and you must seek immediate medical attention as needed. Also, when you see your medical or healthcare provider, they get to give you an appointment. Make sure you adhere to the appointment as given, because of the schedule of a follow-up appointment with a healthcare professional is to discuss the ongoing contraception and also health measures taken, so that your healthcare provider can get to evaluate if whatever was instituted at that particular point is really working, and to help you to a better level, because there are different approaches which can be employed if whatever was put in situ is not working well. And also mind your emotional well-being, because of unplanned situations can be emotional challenging. Seek support as appropriate, because also especially when one is involved in a rape, especially they can be exposed to that kind of infection and also unwanted pregnancy. So it is important to get the emotional well-being. If there's need, you can get a counselor, psychological counselor, to help you to overcome the situations, and also share with appropriate people who can support you at that particular time. Also, educate yourself. So continue educating yourself on sexual health, contraception, and other options which are available as as provided. So guys, very important that you get to take care of good of yourself from especially pregnancy, as a complication of the sexual of unprotected sex. If you can get really exposed to pregnancy which is unplanned or unintended, as a primary concern. Sexual transmitted diseases or STIs, including the HIV, is also one of the risks which you can get to be exposed to. We have emotional stress because of you are worried of the consequences. We have relationship strain because of an unplanned situation which may impact relationship. Open communication so is very important. So future fertility concerns, because some STIs, especially gonorrhea and syphilis, may affect your future fertility. So if they go untreated, that's something which one should always can always understand. So it's very important that we get to also prevent ourselves from future occurrences such as those, because that one can expose us to other problems. So it's very important that if you have any complaints and you have any concern, that you get to see your healthcare provider. Guys, welcome to our channel. The channel is Social Talks. Kindly, if you have not subscribed, I want to encourage you to subscribe, and welcome to our next one. Peace, guys.